Pulmonary Embolism by Stephanie Joseph of Indiana State University, Nursing 444 Community Health, Health Education Project 6. All right, let's start off with a small pretest to see what you already know about pulmonary embolisms. 1. What is a pulmonary embolism? 2. What does a pulmonary embolism affect? 3. How is pulmonary embolisms diagnosed? 4. What are some characteristics of pulmonary embolisms? 5. Who is usually diagnosed with pulmonary embolisms more? Here are the learning objectives for this PowerPoint presentation. The learner will define pulmonary embolism. They will be able to describe how pulmonary embolisms are developed. The learner will also be able to explain how pulmonary embolisms are diagnosed. They will be able to describe signs of pulmonary embolisms, and they will be able to explain the pulmonary embolism treatment options. What is a pulmonary embolism? A pulmonary embolism, aka a PE, is a blood clot that develops in a blood vessel in the body, often in the leg. It then travels to a lung artery where it is suddenly blocked by blood flow. When a clot is in a deep vein, it usually in the thigh or the leg or the lower leg, it is called a DVT, which is a deep vein thrombosis. A pulmonary embolism is the most serious complication of a deep vein thrombosis. Let's see who is at risk for pulmonary embolisms. People who are at risk for PEs are those who are inactive or immobile for long periods of times. They have certain inherited conditions such as blood clotting disorders or factor V lead-in. They could have had surgery or have broken a bone recently. They're at higher risk weeks following surgery or injury of this type. And those who may have cancer or a history of cancer or receiving chemotherapy. Those are the people who are usually at the most highest risk for developing a PE. Other risk factors can be being overweight or obese, smoking cigarettes, being pregnant or giving birth within the last 6 weeks, taking birth control pills or contraceptives are definitely one of the risk factors for PE, hormone replacement therapy, diseases such as stroke, paralysis, cardio disease, chronic heart disease, high blood pressure, serious injury or recent injury or trauma to a vein, severe injuries, burns, fractures to hips or other thigh bones areas, and being over 60 are other risk factors for developing a PE. Okay, so let's talk about how serious a pulmonary embolism can be. A PE is a very serious condition that can cause failure to the right side of the heart. It can cause low oxygen levels in blood, damage to organs in the body because of lack of oxygen. It can cause death if the blood clot gets too large or if there are multiple clots. And it can lead to permanent damage of the lung arteries and later high lung pressure or pulmonary hypertension, which is also a very serious condition. So let's dive into some characteristics and some signs of pulmonary embolism. The symptoms of a PE can vary based upon the individual and the severity of the clot. Some of the key points to remember and some of the key signs to remember are sudden shortness of breath, any type of breathing troubles, chest pain, coughing with or without bloody sputum. If you notice you have an irregular heartbeat, swelling of the leg or along a vein in the leg, any tenderness to your leg, any warmth or pain or swollen areas to that leg, rapid breathing, sweating, clammy skin, increased heart rate. Those are some key signs that you might have a pulmonary embolism. If a patient sees their doctor right away and are experiencing some of these symptoms, they are usually treated very quickly. But in a lot of cases, a lot of people don't know or don't even have symptoms, but end up diagnosed with a pulmonary embolism. So many will say, hey, Stephanie, how would one be diagnosed with a PE? So a PE can be detected based on a patient's medical history, a physical exam, and test results. The tests that are used to detect a pulmonary embolism are ultrasounds of the leg, CT scans, lung ventilation perfusion scans, pulmonary angiographs, blood tests, echocardiograms, echocardiography, chest x-rays, and even a chest MRI. Now that you know some of the signs and symptoms of pulmonary embolisms and how they are detected and diagnosed, let's look at how they're treated. A PE is usually treated in a hospital setting. PEs can be treated with medications, procedures, and other therapies. The main goals of these treatments are to stop the clot from growing and to prevent any new blood clots from forming. The main medication therapy would be anticoagulation drugs. Treatments consist of anticoagulant drugs, also known as blood thinners. Blood thinners decrease the body's ability to clot. They are used to stop blood clots from getting larger and to prevent any new blood clots from forming. Blood thinners can be given in a pill form, in an injection, or through the IV, through the vein. One example is heparin is given usually in an injection or through the IV, and it acts very quickly to help thin the blood and to help prevent the clots from growing larger or from new clots from forming. As they progress and they get to a therapeutic level, they will move on to pill forms such as warfarin or Coumadin, and things of that nature. There are thrombolytics that are also drugs that are used to dissolve or to treat large clots. Those are usually used for only the life-threatening situations. Another treatment option is a vena cava filter, which is a filter that is placed in the large vein called the inferior vena cava. And it is a filter that catches the clot before it travels to the lung, preventing a pulmonary embolism. So those are the treatment options and the treatment plans that are usually used to treat a PE. Here are a few non-invasive treatment measures that can help prevent PEs. Use of compression stockings, using pneumatic compression devices, and getting up and moving as much as possible after surgery or illness. Movement can help keep clots from forming by stimulating the blood to circulate throughout your body. All right, so let's check out how we can prevent the development of a PE. There's a few things that we can do to help prevent getting a PE. Moving the lower limbs while sitting during long periods of time or during travel, getting regular exercise, eating healthy, having a healthy diet, drinking plenty of fluids, avoiding excess alcohol and caffeine. Those are some ways that we can help prevent PEs from developing. Making sure we're getting out of bed and moving around as much as possible after surgeries or any type of illnesses that had us being immobile for a while. Not smoking, and making sure that we follow up with the doctor. If you have a history of a deep vein thrombosis or DVT or PE, there are steps that can prevent new blood clots from forming, and you should be able to visit your doctor on a regular basis to have regular checkups to have those prevention methods monitored so that we can prevent any further DVTs or PEs. Life after a PE. If you're one of the people who have been diagnosed with a PE, you're at a higher risk for developing the condition again. So during and after the treatment, you as a patient should continue to take the steps to prevent PEs. Making sure you're moving constantly, having routine checkups, and following the recommended regimens of medication and non-invasive therapies that your doctor has prescribed for you. You gain a ton of knowledge about pulmonary embolisms. Now here's a small post-test, kind of similar to the pre-test that you took in the beginning, to see how well you were listening. Hopefully you gained plenty of information and plenty of knowledge on things to look out for when it comes to pulmonary embolisms. Now that you have all this newfound knowledge about pulmonary embolisms and you've passed your post-test, if you have any other questions or anything that can come up to mind about pulmonary embolisms or blood clots in general, here's a few references that you can check out to see if they can help answer your questions. Once again, you can always check with your provider and any of the community health nurses around in your area.